Hi, this is Dalverine West Aarons. This is my second video journal. In my first journal, I discussed the fact that I was looking forward to learning so much more that I needed to learn regarding peds. Even though I've been a pediatric nurse for a while, I realized that I've not been exposed to a lot of information that I need to be adequately able to take care of pediatric patients. And so I was looking forward to this rotation. I just completed my rotation with Dr. Michael Zollicoffer, and I must say that this was one of the best clinical rotations that I've had. He is very much into teaching and imparting knowledge, and so I was able to learn a lot from him. Another thing that was very beneficial to me was the fact that he did not make you feel uncomfortable in his space. He made you feel welcome. He made you feel like he was there to teach, and I would recommend Dr. Zollicoffer. With that saying, I have learned so much from him. I've learned about the fact that rashes are so prevalent among the pediatric population. I've learned some things about myself that I had to face. I had some biases that I had to deal with. And one example of that was the fact that I met a client, a patient in his office. Well, first of all, when I was a pediatric nurse and I worked in the facility in the hospital, I had a problem with sickle cellers. People, children, not necessarily children, but young adults with sickle cell. And I thought at the time that they were very manipulative. I thought they used their pain to get things that they wanted. I always thought, well, if you had a PCA with pain medication, why are you still complaining of pain? That was my situation and my position at that time. And so I would ask, when we were getting patients on the floor, I would say, give me 2 patients instead of giving me a person with sickle cell. Well, it so happened that in my clinical rotation, I encountered a young girl. She was 12 years old. Mature-wise, she looked like she was 7. And when I walked in the room, she just started to cry. I did not know her diagnosis at the time. And I gave her a hug. I'm like, why are you crying? And the tears was just rolling down her cheeks. I come to find out that she was a sickle cell patient. And when I asked her mom, trying to get history from her mom, I realized that she had also had a stroke at 7 years old. I was just totally moved. Not just the fact that she was crying, but the fact that now, with higher learning and understanding, you know, being an RN I'm not saying there's nothing wrong with that. There's nothing wrong with that. But I just feel like I have a better understanding of what the pain crisis is and what this child must have gone through. As I walked in the room, like I said, she was so emotional because she expected something that was going to cause her pain. She had just had so much encounter with pain in her life that it made her so emotionally labile. And my heart just went out to this girl. And I'm getting emotional now because I felt it so deeply. Like, how could I have in my lifetime had that bias against somebody who every time they have a pain crisis, it's their life that's being, you know, that could be taken at any time. And so I have decided that in my pediatric rotation, in my pediatric life as a provider, if I do get there, I will make sure that I know everything, the treatment modalities, everything that I need to know, which there's so much that you have to understand when you take care of a child with sickle cell. I've had to face that bias, and I'm ashamed to say that I had those feelings, but I know I'm human and I did have those feelings, and I had to face that. And aside from sickle cell, just any diagnosis that you deal with as a provider, especially in the pediatric population, it's not a joke. You need to know what you're dealing with. You need to know how to handle, how to manage, when to refer, you know, when to send to the ER, because not that adults' life is not important, but children's lives are very important. I also learned from Dr. Zollicoffer some strategies that I could use in practice when trying to get information from young ones who can't really tell you where they're hurting, how much they're hurting, and so forth. And so he was able to impart to me some strategies that I could use in that regard. I'm still learning. I'm learning about rashes, realizing that rashes are a very important part of a diagnosis. Some of them may be just benign, but most rashes are accompanied by more important issues and diagnoses that could be very serious. And so I'm learning that, I'm evolving. I'm so proud of myself when I'm able to look at a rash and give some differentials, come up with a diagnosis and even a treatment plan. So from my first video, I've gone not leaps and bounds, but I've taken quite a few steps forward to learning how to diagnose and treat the pediatric population. I also want to thank my advisors, my professors, and everybody at Coppin who has been so patient with us. This is a difficult thing that we're trying to do as parents and wives and mothers, and having our own families and trying to go to school. It is not easy to be an adult student, but so far I've encountered people who have just been so helpful, so supportive. They're tough on us, yes, I agree, but they've been so supportive and so helpful, and for that I'm so thankful. I also want to thank my classmates who most of the time, with our stresses and our own problems, have been very supportive and helpful as well. I don't know what else to say except that next time if I'm doing a video, hopefully it will be about being a provider, and looking forward to the next steps that will take me in that direction. Thank you.